Hello again, folks. Today we're going to talk about coccidioidomycosis, or more commonly known as valley fever. Mycosis is a fungal infection. It's most commonly known to infect the lungs, but it can disseminate throughout the body, and it's caught and transmitted by breathing in fungal spores that were underneath the ground and disturbed earlier, or it might have been a windstorm, something like that, anything to blow around the spores, and you can bet that the case incidence of valley fever is going to rise. The prevalent strain of Coccidioides that causes valley fever is Coccidioides immitis, and Coccidioides immitis is a dimorphic fungus, which means it has two separate forms. It's mycelium in the soil and a spheral inside the lungs of the human host. And it is saprophytic, meaning it breaks down dead organic material. Another thing that is important to include is the fact that it is found and it is endemic to certain regions of the United States. And these regions include Arizona, California, Nevada, New Mexico, Texas, Utah, and northern Mexico.
Hi, so I'll be talking about the symptoms and treatments for both animals and humans. In humans, symptoms of valley fever include fatigue, cough, fever, shortness of breath, headache, night sweats, muscle aches or joint pain, and a rash on the upper body or legs, with a cough and fever being the most common symptoms of valley fever. Some people may not have symptoms ever, and some may have symptoms that go away on their own after weeks or months. It is important to see a healthcare provider if symptoms last longer than a week. These symptoms usually do appear 1 to 3 weeks after breathing in the fungal spores that cause valley fever. Most of the time, symptoms in humans go away on their own without treatment, but there is antifungal medication that can be used to lessen severity of symptoms, although it is used mainly for people who are at higher risk of developing severe valley fever. And none of these treatments are over the counter. Common valley fever symptoms in animals, and dogs specifically, can include coughing, fever, weight loss, lack of appetite, and/or lack of energy. Disseminated valley fever is when the infection spreads outside of the lungs, and symptoms for that includes lameness or swelling of limbs, back or neck pain, seizures, swollen lymph nodes under the chin, in front of the shoulder blades, or behind the stifles, non-healing skin wounds that ooze fluid, eye inflammation with pain or cloudiness, and/or unexpected heart failure in a young dog. Sometimes primary symptoms will not be experienced, and the dog will only experience disseminated valley fever symptoms. Most dogs that are diagnosed with valley fever need antifungal medication, which takes about 6 to 12 months. Most common medications are fluconazole, itraconazole, and ketoconazole. And alongside with that, there is supportive treatment. And so that includes cough suppressants, pain and fever relief, nutritional support, or hospitalization.
Okay, on this part of the presentation, we're going to talk about prevention of valley fever through government surveillance, as well as treatment and vaccination. So for surveillance of valley fever, as you can see on the map on the right, there are two states, California and Arizona, that have like a lot of dark spots, and like a few other states that have them too, but mainly California and Arizona. And the dark spots indicate higher cases of valley fever, and the maroon red is like the highest cases. I got this from the CDC website, by the way. But the CDC is a organization that does a weekly report of infectious disease cases around the country, and they get that from public health departments. They get it from like hospitals and labs that report a new case of whatever infectious disease, in this case, valley fever. But this is called the Morbidity and Mortality Weekly Report that is renewed every Wednesday. And unfortunately for Arizonans, if you live in Phoenix or Tucson, you are actually in the highest hotspot for valley fever in the country, and you're at higher risk of contracting it. So for treatment of valley fever, usually the treatment is just letting the infection pass through you within a six month period. And this is the reason why a lot of cases aren't reported, and that is suspected that there are more cases than there are known, because usually it's not diagnosed. But for people that do develop valley fever, get diagnosed, and they develop severe symptoms like pneumonia or meningitis, which is like the fatal symptoms of it, and really rare, there is antifungal medication called fluconazole for severe cases. And then the fatal ones where you get like meningitis are lifelong medications for these infections. So vaccination, there is no vaccination for valley fever for humans or dogs. However, there's a lot of research going into vaccination for valley fever. And I found a really interesting article about the U of A, as a matter of fact, in which researchers at the U of A created like a live attenuated form of the fungus that causes valley fever, like a weaker version. And they gave it to mice, and the mice didn't develop any symptoms of valley fever, even though it was like the same species of fungus. And when they were reinfected with a virulent strain of valley fever, they actually didn't develop any symptoms of valley fever. And that even applied to the immunosuppressed mice that had like chemotherapy done to them. They still didn't develop any symptoms. So this gives hope for a future vaccination for valley fever for humans and possibly dogs to help negate or mitigate the spread of valley fever. And for the next like few slides, we're going to talk about the prevention of valley fever through risk factors and how to protect yourself. And I'll give that to Katie.
As Casey just mentioned previously, there are many different medical interventions available to help you protect and treat both you and your dogs for valley fever. However, in addition to this, there are other ways to protect yourself in order to ensure that you avoid infection in the first place. The CDC has made education and awareness a big part of their fight against valley fever. This includes things like working with state and local health departments to educate and inform the public about the risks associated with the disease, as well as working directly with healthcare providers to expedite testing and diagnosis and to improve the treatment and outcomes for these valley fever patients. Now, it's very hard to avoid the fungus that actually causes valley fevers in areas where it is common, such as here in the Southwest US. However, there are some measures the CDC recommends that you take in order to best protect yourself. First of all, always try to keep you and your pets away from dusty areas and activities like construction sites, digging, or gardening. Additionally, keeping gravel or grass in your yard in order to cover the dirt where the fungus grows can help protect dogs who tend to sniff around in the dirt. If for some reason you do have to visit one of these dusty areas, make sure that you always wear an effective N95 face mask in order to avoid breathing in fungal spores. Additionally, in areas affected by dust storms, make sure that your windows are closed during storms and that your homes are well sealed. Also make sure that your air filters in home are present and that they have been changed recently. There have been recorded cases of valley fever entering the body via skin lesions, so it's important to always wash and clean all skin injuries with soap and water, especially if those may have been contaminated with dirt or dust. Finally, if you are someone who has been deemed more at risk for contracting valley fever, which includes weakened immune systems, pregnant women, people with diabetes, or individuals over 60 years old, make sure to take extra precautions to avoid breathing in these fungal spores. If you are especially worried that you may be at risk, the CDC has recommended to consult your healthcare provider, who may be able to administer preventative antifungal medication. All of these preventative measures also apply to people traveling to areas with endemic valley fever. Ultimately, the CDC predicts that the total number of cases in the Southwest is underrepresented, which means that it's especially important that you take these proper precautions to significantly reduce the chance of you or your dog becoming infected with valley fever. Thank you for tuning into this PSA, and to find out more information on valley fever and associated statistics, please visit the CDC website.